My topic is analysis of retinal microvasculature in retinal vein occlusion using ultra-wide field optical coherence tomography angiography. So retinal vein occlusion is one of the most common retinal vasculopathies with a global prevalence of 0.77% among people from 30 to 89 years of age. Based on site of occlusion, there are two types of retinal vein occlusion, the central retinal vein occlusion and the branched retinal vein occlusion. The aim of our study is to compare retinal microvasculature features between eyes with retinal vein occlusion and age-matched controls using ultra-widefield optical coherence tomography angiography. Materials and method. This was a retrospective cross-sectional study in a tertiary eye hospital in South Kerala, conducted involving 15 eyes diagnosed with RVO, which included 5 eyes with CRVO and 10 eyes with BRVO between the age of 55 to 77 years of age between November 2024 and May 2025. Inclusion criteria included those diagnosed with retinal vein occlusion on presentation, and exclusion criteria included those who had any other retinal pathologies. We used the ultra-widefield swept source OCT and ultra-widefield swept source Octa images, and they were captured using the Inter-Eye Dream SSOCT system. Swept source OCCs uses a longer wavelength and use photodetectors instead of CCD cameras, which are used in the HD OCT, which increases resolution, and they have a higher scan speed, which is twice as of the SD OCT devices, thus allowing us to obtain wide field B scans and more accurate 3D imaging of the vitreous retina and choroid. The Dream SSOCT has significantly shorter acquisition time for Octa images and a high scanning rate compared to the Spectralis OCT with the scanning rate. The features investigated were the foveal avascular zone, which was measured using the manual caliper tool in the system. And then we looked at the vessel density of the superficial capillary plexus and deep capillary plexus. And we divided the area into the central region, which composed of 107 millimeter square area at the central region, and the peripheral region compared the rest of the image captured by the system. And we also measured the central foveal thickness. The results were cases showed an increased foveal avascular zone area, and in the vessel density, cases show a decreased vessel density of the deep capillary plexus in the central and peripheral area compared to the controls. And then the superficial capillary plexus cases showed a decreased vessel density in the central area. And when looking at the deep capillary plexus in the peripheral region, the central retinal vein occlusion cases showed a more decreased vessel density than the branched retinal vein occlusion cases. And at the superficial capillary plexus level, they were also showed decreased vessel density in the peripheral region, more for the CRVO cases than the BRVO cases. The cases also showed a increased central foveal thickness compared to the controls. The cases also showed a negative correlation between the foveal avascular zone and the vessel density of the peripheral deep capillary plexus and superficial capillary plexus. The foveal avascular zone increased with decrease in the vessel density of the peripheral and vice versa. So in this study, we see that the cases showed significantly reduced central vessel density in both superficial capillary plexus and a deep capillary plexus, and also lower peripheral vessel density in deep capillary plexus compared to the controls. Vessel density of the deep capillary plexus of the peripheral region of the CRVO cases is lower than the BRVO cases, but is not statistically significant. And foveal avascular zone area and the central foveal thickness were higher in cases. So our study and other similar studies showed an increased foveal avascular zone area in cases with the retinal vein occlusion and a lower peripheral and central superficial capillary plexus and deep capillary plexus vessel density in cases than in control eyes. So, ultra-widefield swept OCC angiography facilitates the evaluation of retinal vasculature beyond the posterior pole, enabling better characterization of the ischemic changes in RVO. Therefore, it may serve as a valuable non-invasive tool for guiding treatment decision, assessing prognosis, and monitoring disease progression in the future. So these are my references. Thank you. When the foveal avascular zone increases, there seems a decrease in the vessel density of the deep capillary.
How do you explain?
So I have looked.
Actually, the way I look at it, arterial occlusion, there can be a decrease in vessel density. In a venous occlusion, there is stasis and retention. No. Why should the capillaries disappear? The capillary should be there engorged with blood. Blood is not able to return back. So that thing is there. Slowly, we feel that the links which you are establishing are very superficial. So you'll have to like create a bigger base of patients and try to work it up so that we'll have some solid conclusions. Thank you.